Thank you, everybody. I'm Dave Perry, President and CEO of the Chamber, and that's Kristen Sharp, our events director. Welcome. Jennifer's going to make a presentation. She's got a PowerPoint, and then we'll do questions. Jennifer Schomburg is the CEO at Northwest Medical Center and Oro Valley Hospital. She joined Northwest Medical Center as the Chief Operating Officer in 2015, was promoted to Chief Administrative Officer in 2017, and again to CEO in 2019. She added Oro Valley to her scope of duties in 2020. Good timing on the pandemic there, Jennifer. Prior to her time in Tucson, Jennifer led hospitals in New Mexico and in Las Vegas. She's originally from Missouri, as is Kristen, so they were just telling Missouri stories. And Jennifer and her husband, Adam, they live in Oro Valley. So Jennifer, it's so great of you to make the time. Let's give a verbal wave and welcome, please, to Jennifer Schomburg.
Well, Dave, thank you so much for that introduction. I am honored to be here and have the opportunity to speak about our organization this morning. So I think we've got a PowerPoint ready. All right. Well, first of all, I am, as I said, so excited to be here and very proud of the growth that we have really been able to see over the last couple of years with Northwest Healthcare under the guidance of my boss, Kevin Stockton, who's the regional president, and then with me kind of stepping in. So had a great experience here in Tucson. Our 4 hospitals, 3 of them are open today. We'll start kind of going through what each of them are comprised of. So the first is Northwest Medical Center. We have 300 beds. Services include cardiology, bariatrics. We do orthopedics. We have a heartburn center, GI, and urology. Oro Valley Hospital has 146 beds. Very similar offerings, but also have a behavioral health unit, and we're going to talk about some additions there as well. We just opened a hospital at the end of last year in the middle of a pandemic, which is absolutely a fascinating experience. I wouldn't recommend it to anyone, but we are very excited that we have our hospital open in Sahuarita, just a really quickly growing area of our community, and are delighted to provide additional healthcare services there. So it's a neighborhood hospital. We have 18 beds there, cardiology, ER, imaging and labs, primary care, and we are continuing to recruit additional specialists into that area so people can keep their care close to home. Also very excited, if you look at that bottom picture, is a rendering of what the hospital will look like sometime at the end of the year. So hopefully in December of 2021, we'll open up a hospital over on the east side called Northwest Medical Center Houghton. It'll have 70 beds. So that is a gorgeous new hospital. We'll have similar services to what Oro Valley has, but in addition, we'll be doing deliveries and have a NICU there. So when you look at our strategy with Northwest Healthcare, we really have focused on making sure that we are building hospitals and building healthcare access points in the areas in which people actually live, close to their homes, and really where we're seeing growth within our community. Next slide. Each of our hospitals have certainly the general services, right? So we all have ER, we all do surgeries, but we've begun to really specialize and have specific niches at each of our organizations. So at Northwest, bariatric surgery, robotic surgery. So we have the largest presence of robotic surgeries in Southern Arizona, but also with my larger company. So we do general surgery, gynecological surgery on the robot, open heart surgery, which is pretty amazing, joint surgery, and urological surgery. We've grown our cardiothoracic surgery capabilities, so heart and lung surgery, structural heart program, which is a lot of things like implants, right? So different higher level surgeries above and beyond what you would do in a cath lab. We've focused on digestive disease here at Northwest Medical Center and also at Oro Valley. So what we found up here in our northwest side of the community is we were sometimes having some delays in getting patients in to be able to get a colonoscopy or deal with digestive services. So the addition of not only physicians to that service line, has created capacity and our capability to get people in very quickly to address their digestive health issues. At Oro Valley, we have seen some really great additions there as well. Again, expanding our behavioral health capability, not only from an inpatient standpoint, but also from an outpatient capability. We know behavioral health is a shortage across our entire nation, and I am very proud that we have addressed some of that need up in Oro Valley. Inpatient rehab, so not only do we have our acute level of services, but we're also addressing some of those post-acute services or in those transitions of care. Cardiology, and then we also have a robot presence at Oro Valley as well, where we do general surgery and a high number of joint surgery. Next slide. So again, I talked a little bit about our access points, but making healthcare convenient and easy to access for people in our communities is a large part of my job and of all healthcare organizations. So we have 3 hospitals, soon to be 4 urgent cares, 2 surgery centers, 2 freestanding emergency rooms. We have 46 providers that provide primary care in 15 separate locations across town, 45 providers that provide specialized care like general surgery, cardiology, those pieces, and they're spread out amongst 31 locations across town. And then we have a number of outpatient services, including imaging, therapy, lab, wound care, and sleep lab. And if you look at our strategy, we're now able to cover a 50-mile radius around Tucson to provide those services. Next slide. So last year was a fairly tough year for all of us, and I want to say thanks to all of you for hanging in there with us. We have gotten through it, the majority, and I'm very delighted to say our COVID numbers have dropped drastically. But I do want to reflect on last year and the past several months for just a moment. We were able to run 71,500 plus a little bit COVID tests within our organization. That's a significant volume increase. And we took care of 1,375 patients. Our first patient here that we received at Northwest was the second patient in our county, and that was on March 13th, Friday the 13th, last year in 2020. So very, very proud of our organization and our team for providing a high level of service and also the kindness, I think, and caring that our staff has really demonstrated for the community over this past year. Next slide. So these are just some pictures of the staff and the great work that they have done. You see right there in the middle with that big yay sign and good luck. Every time we were able to discharge a patient that was in an inpatient status with COVID, we had a huge celebration, really just celebrating not only the patients being able to go home and get back to a semblance of normal life, but also the staff and the hard work that they were doing. They took a lot of time away from their loved ones to be able to continue to take care of our community. You see a lot of PPE, so personal protective equipment and all the things that we needed to wear and make sure that we had enough of to continue to take care of our community. Certainly the nursing staff, the physicians, our lab staff that you see there in that bottom right-hand corner, our housekeeping staff went above and beyond and just did an extraordinary job. So I've always said that healthcare is the ultimate team sport, right? But last year, I think our organization really demonstrated that. Next slide. So I'll tell you, the healthcare team did a wonderful job, pushed through a lot of things, but I'll tell you, we could not have done it without you. The community support that we saw from our area restaurants, from our churches that came out and reached out and just said thank you. You see the chalk drawings. We had a couple of kids from different area elementary schools come in and draw chalk drawings on our sidewalk. So as the staff went in, they felt a little less lonely and knew that people out there knew the hard work that they were doing, and it was appreciated. You see in the middle kind of frame on the right-hand side, elementary schools and preschools did just a whole bunch of drawings and sent cards into the staff and the patients that were here to tell them thank you and that they were thinking of them. In the bottom right-hand corner, different area companies like Lowe's donated cleaning products to us, different PPE pieces. And up in the top left-hand corner, you can see one of the restaurants, Chick-fil-A, just many restaurants donated food and time to be able to let our staff know that they were loved and they were remembered in that difficult time. So a huge thanks to all of you for those kind and caring just touch points. Next slide. So this is the Golder Ranch Fire District. You see Chief Carr right there to the right-hand side. I am really proud of Oro Valley Hospital and the team that the ER did, and I am also really proud that Golder Ranch recognized Oro Valley Hospital's emergency room team and nurses as the healthcare heroes for 2020. What's really cool about that award is, number one, that it exists and that certainly the team won it, but our Chief Carr shared that their team unanimously voted that they were the healthcare heroes, and they came in and delivered it in person. So a really nice nod and recognition towards the team's diligence and their hard work. Next slide. So let's talk about safety for a second. We still are having some COVID cases, and safety is absolutely and will always be our #1 priority. COVID testing is still required before surgery. Our staff and visitors are screened on entry. We are still requiring universal masking within the healthcare, within the hospitals and our clinics. We are offering telehealth appointments in our clinics, so for folks who aren't comfortable or coming in, or honestly just feel like it's more convenient, can utilize telehealth now and into the future. I think that's one of the things that will remain consistent within our business even after we are completely done with this pandemic. We have increased sanitation. Our waiting areas are closed, or we are practicing social distancing, so just visitors are limited. And we continue to vaccinate our staff. Next slide. So what new things do we have going on? I told Dave at the beginning of this call, he said, how are things going? And I said, man, I am just so excited to talk about things that are not COVID. I can't tell you how delighted I am to get back to a little bit more of a sense of normalcy. So I talked a bit about our continuum of care and our offerings, kind of making sure that care was in the communities that are growing and where people live within Tucson. One of the other things that I'm so excited about is our new post-acute building, which is right here on the Northwest Medical Center campus at the corner of Orange Grove and La Cholla, and it's called our Northwest Transitions Building. So in healthcare, we've always focused on safety, right? And the #1 opportunity for errors, or places where we could cause harm, really has everything to do with medications and giving people medicines, right? The second opportunity to cause harm is in handoffs of care. So when we discharge a patient to a skilled nursing facility or a rehab or home health, there's a lot of communication that needs to take place. And unfortunately, we're still human and there are still errors that exist. So in order to really mitigate or lessen the amount of errors, we have begun to build our own post-acute pieces within that continuum. So the Northwest Transitions Building, it has 60 beds, 30 beds on the first floor, 30 beds on the second floor, and we'll have a long-term acute care facility with 30 of those beds being long-term acute care and 30 of those beds being the inpatient rehab facility. So we'll have our staff and doctors certainly going to that facility, but also being so close to the hospital. Our hope is that we'll be able to take care of emergencies much more easily than we would be with them being further away from the main hospital. Next slide. I'm also very excited, and Dave, I know you are super excited, and my board is excited in Oro Valley, that we have a brand new MRI at Oro Valley Hospital. It is a 1.5 Tesla MRI, and for those of you who don't know exactly what that means that it's a lot quicker. It has significantly more power. It has a much broader range of capability when we look at the types of testing that we're able to perform on this scanner. And for those of you maybe that are like me, that are even just maybe a little bit less clinical, I'm not clinical in any way, here's what it means for the layman. I actually went and had an MRI done when we were testing the different protocols just to see what it was like. And I'll tell you, if you look at the circular part of that machine that you can see on your computer right now, it's much larger, so you feel like you have more room when you're getting the test done. It's also shorter, so you feel like you're not exactly as claustrophobic within the machine. It has a capability where you can actually go feet first instead of head first, again, to help out with that claustrophobic feel. It is instead of having tests that are like an hour and a half long, we're able to do testing that are taking 11 minutes, 15 minutes. So very exciting additional technological capabilities for the hospital that's much quicker and will be a much better experience for our patients, but also be a much higher level resolution and imaging for our radiologists and our cardiologists to be able to read. Next slide. At Oro Valley, we also remodeled and relocated our outpatient therapy, so it's right next door to the hospital in the medical office building. Absolutely gorgeous open space. Our patients are loving it. It's much easier to find than our old outpatient therapy, and again, I love it being close to the hospital. So we see a lot of, I would say, continuity between our inpatient and outpatient therapy staff. And then we also have remodeled and relocated women's imaging. So for mammography, DEXA, all those pieces focused on women's imaging, again, right next to the hospital at the medical office building, and it's a gorgeous location. Next slide. So Dave, that is the conclusion of my presentation this morning, really talking about COVID, where we are currently, and kind of where we're headed.
Thank you, Jennifer. And if anyone with questions, please put them in the chat. And before we get going on that, Jennifer, one of our guests expressed their thanks for the Northwest Medical Houghton investment that you're all making as you try to expand your offering of services across the community. Jennifer, you and I talked briefly about the pandemic, and I wonder if, in broad summary, what was the hardest thing for you about it, and what did you learn?
You know, what I learned really was about the resiliency of our staff and the commitment, and I think that is just absolutely at the core of our caregivers. That people were leaving their families to really charge into a really scary place, not knowing if they were, you know, unfortunately exposing themselves or their loved ones to a virus that we didn't know much about back in March when we got our very first patient. So I'll tell you, many of our staff had to sleep away from their children, had to stay in different locations, and to continue to choose their calling in life, sometimes and put them a little bit ahead of their family. So for months at a time, I think was very telling to how just incredibly dedicated they are to the community and to their patients. So learned a lot about the staff and their strengths from that nature. The hardest thing was really just staying on top of all of the changes and making sure that we were communicating effectively to keep everyone safe and to stay at the forefront and making sure that we were continuing to have the latest therapies for COVID patients and to really do the right thing and the best for those very, very sick patients.
Somebody asked, one of our guests asked Jennifer, how many COVID patients are you seeing now?
Well, I am delighted to report that we have been down in the single digits in our hospital. At one point, we were in the mid-hundreds, 137, 140 patients at any given time in our system, and we've been down to 7, 8, and 9. So very exciting. The other thing I would say is we had our ICUs really full for a while with COVID patients, and now what we're seeing is that we're able to take care of the majority of those patients at a medical surgical, so not at that critical level. We're able to catch things pretty quickly with all of the things that we've learned prior to them getting to that ICU level of care.
Are visitors allowed in the hospital now, or will they be?
Yes, visitors are allowed in our hospitals and our clinics, surgery centers, all of our areas of care now, but we have limited the number. So those rules do change as we're continuing to see the numbers decrease. So I would say if you have any questions whatsoever about the most up-to-date information for visitors, please go to our website. But right now, we're allowing like one visitor with our emergency room patients. We're allowing one visitor for specific time periods during the day for our inpatients. In our surgery centers, we're allowing visitors to come in and hear about the discharge instructions and those pieces really to focus on patient safety. Again, those will continue to change in the future, so I would just say go directly to our websites and we'll keep you all up to date, I promise.
Jennifer, the pandemic has affected every life, every individual, and it has especially, I think, rocked your world. Do you think that there will be permanent changes in the way that you operate facilities and healthcare as a result of this experience?
Absolutely. I think that there are many intangibles, Dave, that go along with that, but some of the hard and fast things that I could actually share would be really focusing on telehealth. You know, we rolled that out really to ensure that we were to maintain a safe type of care that was easily accessible for our communities. And I didn't know how that would be received. I don't think anyone did across the nation, if people were going to really like that, if people were going to be able to figure out the technology. You know, not everybody has a smartphone, and if they do, or, you know, our laptops, not everybody knows how to utilize them for things just like we're doing right now, Zoom calls, right? That was a little bit of a learning curve for many people. But telehealth was embraced by our community, and even when people are feeling safe and they can go into the doctor, many people are still choosing to be able to have discussions with their providers right from, you know, their living room couch. So we have our clinics open. We are safely seeing people right now in person. So that choice is still is absolutely available today. But as far as being able to utilize telehealth, that will always be an offering that we will continue to provide for our patients that choose to utilize healthcare in that manner.
Interesting. And I had a telehealth appointment, and if I'm able to pull it off, I think anybody can. Remember, chat your questions into Kristen, please. Here's a question, Jennifer, and I don't know the terminology. Does the new MRI do fMRI? And will that be used in the behavioral health unit? I don't know what fMRI is, so maybe you could explain that.
Well, I also cannot answer that question this morning, but I think it's a fantastic one. And Dave, what I would say, if you can tell me, well, not right now, but in the future, after this call, if you can tell me who asked the question, I can tell you, I'll look into that and I can get back to you. The MRI can do for 200 different types of tests. And although I can run a hospital very successfully, I do not know over all those 200 tests that it has the capability of performing, but we can get back to whomever asked that question.
Thanks. And I wasn't trying to throw you a curveball there or anything, but I understand.
No problem.
And, you know, when I met with Jennifer, when she became the CEO at the hospital, she said right up front, look, I'm not a clinical person. I know how to run a healthcare system, but not beyond that. Jennifer, I want to ask about the medical office building right next door to the hospital, which I know you don't own that place. You've now relocated several services, the outpatient physical therapy, women's imaging. What else is happening in that building that you could share?
Absolutely. Well, we are continuing to recruit specialists and primary care providers, and it is my hope to have that whole medical office building filled up with different doctors and different types of specialties to make it very convenient for our community to access care. So Dave, I would say we're just continuing to recruit. Some of that, because of COVID, you know, is still online, and so it's not as quick as it used to be when we were able to just fly people out and have conversations and move forward. But we have made significant progress in the last couple of months of recruiting of providers, and so we will just continue to fill those medical office buildings up with doctors to see patients.
I know that recruitment is a constant challenge for you, both in terms of physicians and I know nurses. I've seen your programming and promotions of events to attract nurses. Could you share what your staffing situations are and what your challenges are in recruitment of employees?
Sure. Well, we do have, I would say, a little bit higher number here in Tucson of what I would refer to more seasoned nurses than other areas of the country. So we really had anticipated over the next 2 to 5 years a lot of our nurses retiring, and not only nurses, but clinical staff, because again, just really comprised of a bit more seasoned population. So we had planned for that. We didn't plan for the pandemic. No one did. So what we saw over the past year was really some of our nurses retiring earlier if they were able to, retiring earlier maybe than they had planned. We also saw many of our clinical staff that were, you know, in a position to retire earlier, go ahead and do that. So they were able to take care of their grandkids or other family members, so that way younger family members could continue to work. So I would say that it's accelerated our need to recruit more clinical staff maybe than we would have had to without the pandemic. Across the nation, there's a nursing shortage, there's a nursing tech shortage, phlebotomy shortage. Many of our very important, I would say, specialized areas have shortages, but that is not different than any other place, you know, across the nation. So what that means is that we have to be more attractive, more innovative, more nimble as an organization to really make sure that people want to work with us maybe more than they do other folks. So we continue to work on our culture and making sure that we are a welcoming place and a fun place. Even though it's stressful, we can make healthcare a fun place to work. And we've just continued to be focused on that, Dave. But, you know, the shortages are real, but they are not unique to Northwest Healthcare.
Sure. And in a related question, somebody asks, you know, you're the administrator of these facilities. How do you keep a pulse on what your providers are feeling, what they need to provide improved patient care? How do you do it?
Sure. Well, I think one, just by listening. You know, one of my most favorite things, and one of the reasons that I got into this career, is because I get to be surrounded by a group of incredibly intelligent people. You know, our physicians, our nurses, those folks are at the bedside. They know the solutions to the problems they're bringing forward. I would say 9 times out of 10, you just have to spend time with them, be accessible, and listen to what those solutions are, implement them, and make sure you circle back and let them know you're doing those things. So do I always get it right? No. But I will tell you, I spend a lot of time talking to our physicians and our nurses about what do we need to do to not only take care of our patients right now, but also to ensure that we are right on that cutting edge going forward. So I'm very available. I do breakfast, lunch, dinner, happy hour, coffee, lots of text messaging. So I think it's just availability and listening and actually doing something with the information that I'm given. So fairly simple. I think that would be common in all businesses.
Appreciate that. And I think, you know, people like us and myself, I run a small organization that has a lot of members, and we're always trying to talk to our customers. And in your case, the customer might be the provider, I think. And how do you take care of them? Jennifer, what is it that you need from the community, both in terms of business, in terms of residents, and in terms of government? What things would be helpful to you as you try to run these facilities and take care of people?
Sure, that's a great question. It's a broad question. I think what we need is I would like everyone to hear that our organizations, there's still just a lot of fear, I think, right now, and I think a bit of trepidation in regards to seeking healthcare. And what I can say is that we are good at what we do. The people I work with are incredibly intelligent, and they have done a wonderful job of putting processes and procedures and things in place to make sure that we have locations all throughout our organization that are incredibly safe, and we are ready to take care of you. I want the community to hear they don't need to delay care. One of the things that really broke my heart over this last year is we had people who would come in just past the point of where they really should have come in, and really went through a lot more illness than they had to, a lot more suffering than they had to, because they didn't feel safe coming into our different healthcare spaces. So we are safe, we are ready to take care of you all, and please do not delay care. That's the message I would most hope to get out this morning. Secondarily, what do we need the community to do, or government to do? I think just get kids excited about healthcare and about science. What we do is fun. What we do, I think, is honorable, and I love my job. So I think just getting more people interested in going into healthcare and really filling these gaps that we're going to continue to have as we, again, see these national staffing shortages.
That's great. And as a little segue there, I hope you all tune in on May the 6th for our Oro Valley Bioscience Spotlight. And you talk about excited and interesting people. We got interviews with the 2 inhabitants of the incubator, which is right across the street from the hospital. We're also going to announce the winner of our $10,000 sponsored launch. Your chamber's putting up $10,000 to pay somebody's rent for 1 year at the incubator, and it's a fascinating thing. And then we just were looking at video yesterday. We did an interview with a scientist from Roche who talked about an innovation that he and his team have arrived at to improve cancer diagnostic and treatment. And I'll give you a hint, it involves a kitchen blender. And but stay tuned for more, and don't get any bad thoughts. It's actually really cool stuff. Jennifer, are there things subjects that we haven't discussed here that you would like to get out? And I know you mentioned, let's get the word out about safety, don't delay your care, all services are available. Now, what else would you like to share with our guests today?
You know, I think that those are absolutely the focus and the important thing this morning, Dave. As this is a business meeting, I would, the only other thing I would add is just a little bit about our economic impact. We employ just a little bit over 3,200 people within our organization, and I take great responsibility in making sure that they are cared for, and again, that we have really good strategies in the future to keep everyone employed and still give raises and all those things that we all focus on as we're leading businesses. We have really invested a significant amount of dollars here in our community in capital projects alone. So where we're spending a great deal of money, we've spent about over $4 million at Northwest Medical Center, over $1 million at Oro Valley. In property and sales taxes, we pay about $29 million between the 2 hospitals. In payroll, so just in wages, salaries, benefits, we're paying about $164 million at Northwest, almost $60 million at Oro Valley. We are a for-profit organization, but I also want to dispel the myth that we're not giving charity and uncompensated care. So anyone that comes to our ER, we take care of regardless of their ability to pay. Over the past year in charity and uncompensated care, we provided $42 million of uncompensated and charity care at Northwest and almost $11 million at Oro Valley. If we rolled all of those dollars, including the dollars spent locally with our local vendors, we spent $176 million with local vendors at Northwest, $65 million at Oro Valley. So if you add all that out to the overall community benefit in hard dollars, not the healthcare piece, but the hard dollars spent here in our community, it's over $400 million at Northwest and about $150 million at Oro Valley. So I am very proud of the investment that the community has made in our organization, and I tell you, we feel that every single day, and I can't thank you all enough, but I am also very proud of the investment that we give back to our communities.
That's terrific. And Jennifer, in ways, healthcare is a twofold driver of a community and an economy. You've just mentioned the investments that you make, the number of people that you employ, the charity care, all the capital that you put in. And from a business perspective, a good healthcare system is good economically in terms of attracting and retaining families, employers, having a robust kind of a place to live. And you know, I lived in small towns where healthcare was a challenge and the economy suffered as well. And all those things go hand in hand. I'm always trying to get people to connect the dots on that. So we sure appreciate everything that you do and what you're doing, and want to be supportive of you in any way. Any other questions for Jennifer before we get about our day? Oh, Kristen's putting up register for next week. That's right. We have Danette Bewley is the CEO of Tucson Airport Authority, and she's our next guest on Let's Connect on Thursday, the 29th, 9 a.m. And Danette's going to talk about what's happening at the airport. They've also had their COVID impacts, of course, and I love the fact that both Jennifer and Danette are residents of Oro Valley. So they'll be here as our neighbors and as key leaders in the community. I think that does it for this morning, ladies and gentlemen. Thank you all for being here. Jennifer and Veronica Apodaca, who's on our board of directors. I see other directors. We just want to thank you all for your time. Again, this will be recorded and we'll post it and we'll follow up with any questions that you may have. I think we'll call that a day. Thank you so much, everybody, and be safe and be well out there. Take care.